welcome to Local Health Now with Guthrie. I'm Renata Steele, and I am talking with Dr. Chris Moheimani, who is a general surgeon with Guthrie Cortland General Surgery. Doctor, thank you so much for joining us today. And we are talking about, it is Colon Cancer Awareness Month, and we are talking about colonoscopies today. And my first question for you is, how is a colonoscopy preventative, and what happens if something is found during a test?
I'm glad to be here, and these are important questions. Bad things happen where the sun don't shine, and research has shown that at certain ages or a given history, it's important to check the interior of the colon for growths or polyps that, although small and not declaring themselves, probably are important to find and then address before they become a big problem.
Okay, and now as a general surgeon who sees this type of cancer, what do you recommend for screening and why?
The guidelines are fairly clear. Across the board, colon cancer screening should start at age 45. Colonoscopy is the gold standard. And then based on either family history or findings at colonoscopy or other features, an interval between the first colonoscopy and other colonoscopies can be established.
Okay, and now there is some patient prep work that needs to be done before their appointment. So how does someone prep before this type of procedure?
That's a really good question, and I think a lot of people have concerns about this. The prep is probably the least pleasant portion of the colonoscopy. It happens the day before, it happens at home. Whoever does a colonoscopy will give you the prep that works best for them. There are a bunch of them. But basically, you'll typically have just clear liquids and then take some material that sweeps all the stool out of you. The most important part is to follow the directions and stay very well hydrated.
Okay, and how does someone go about setting up a colonoscopy? Is there an office visit beforehand? Can you walk us through that?
Usually there's going to be a primary care physician or provider who helps you keep track of your health, and then either something will happen clinically or you're of an age and they'll advise you colonoscopy is something that you should get. So make sure that you have a primary care provider or practice. There are some colonoscopy practices where there'll be a series of phone calls, especially now with COVID, and you can do some of this prep work in terms of finding out about the particular person who's doing the test and then how it applies to you. You can do this via Zoom or Teams or one of those approaches. Many of us, and I'm one of them, prefer to meet with the person, or at least have somebody from our office, a physician assistant or a nurse practitioner, meet and then physically be present to you, examine you, and address your questions directly beforehand. Typically, it's within a calendar month of the procedure that's scheduled.
Okay. Well, Dr. Moheimani, thank you for joining us today and talking to us about this important procedure and what people need to know. Thank you so much.
Thank you.
And thank you all at home for joining us for Local Health Now with Guthrie.